The bond between humans and animals, especially dogs, is undeniably strong.
We're really just starting to understand maybe the tip of the iceberg on the power of the human-animal bond. We often joke, be the person your dog thinks that you are.
And when it comes to therapy dogs specifically,
they definitely provide a non-judgmental presence, and they're often a social catalyst, so they encourage people that are sometimes quiet to come out of their shell and talk.
Making therapy dogs a breed of their own.
It doesn't mean they have to be picture perfect. It means they have to have the characteristics fitting of a therapy dog. Friendly, loving, calm.
Discover care of the dog. The positive impacts of therapy dogs. Inside this edition of CTSI Discovery Radio. Welcome to CTSI Discovery Radio. I'm your host, Brian Belmer. CTSI Discovery Radio is brought to you by the Clinical and Translational Science Institute of Southeast Wisconsin. The CTSI is a consortium of researchers, doctors, scientists, and others representing 8 institutions, including the Medical College of Wisconsin, Milwaukee School of Engineering, Marquette University, the University of Wisconsin-Milwaukee, Children's Wisconsin, Froedtert Hospital, Versity Blood Center of Wisconsin, and the Zablocki VA Medical Center. The CTSI works collaboratively across all of our member institutions. Our mission is advancing health through research and discovery. Recently, while walking on campus, I came across some therapy dogs at the Medical College of Wisconsin. It got me to thinking, what exactly is a therapy dog? How do they become a therapy dog? And what kind of therapy do they offer humans? So, on today's show, we discover the answers from some experts in the field. First, though, it's vital to understand the significant bond between humans and animals in general. For this, we reached out to Dr. Taylor Chastain Griffin, a research psychologist with a focus on human-animal interaction and National Director of Animal-Assisted Interventions Advancement at Pet Partners. Dr. Chastain Griffin begins by giving us a brief introduction to what Pet Partners is.
Pet Partners is one of the largest therapy animal organizations in the world, and really at the core of all we do is to empower people who have pets that would make a good therapy animal candidate to become a legitimate therapy animal team and volunteer throughout their community to bring the power of the human-animal bond to people in all walks of life.
When we think about pets, especially therapy pets, our minds most commonly go to dogs and cats. But
we at Pet Partners recognize 9 different species that can be therapy animals. So that's most commonly dogs. We have equines as well, cats, rabbits, pigs, guinea pigs, birds. Animals we determine that can be therapy animals are based on our understanding of infection risk. So can we safely take them to places that might have, vulnerable health and make sure we have all the vaccine protocols and potty training and all of those important things in place. But the beautiful thing about the human-animal bond is it really extends across all species. So any animal that a person can bond with, we can see those benefits of the human-animal bonds. People who really love their lizards report having better lives because they have their pet lizards, and the same thing goes for dogs, cats, and all the other species.
Next, we asked Dr. Chastain Griffin to share when and how Pet Partners began.
Pet Partners is really interesting in that we've been around for a very long time, actually back to 1977. So we were formerly known as the Delta Society and really started out of an appreciation for the power of the human-animal bond. And back then, it was kind of more anecdotal. There was a group who believed strongly in the power. It was a veterinarian and his psychologist brother who realized that animals just really meant a lot to the people who they interacted with. And so we were founded all that time ago and have really grown, evolved over the years to become the organization that we are today.
What exactly is the mission of Pet Partners?
Our mission is really broad at Pet Partners, and that's to empower the human-animal bond. And so we do that primarily through our therapy animal program, which has thousands of teams actually across the globe who share the love of their pet throughout their community. So we really know that impacts between humans and animals, whether they're your pet or a beloved therapy animal in the community, can make a big difference, and that's the core of all that we do.
What is the human-animal bond she refers to, as it seems to be truly the essence of Pet Partners?
We define the human-animal bond as the mutually beneficial relationship that we share with animals, and that's really important to us because we don't just want to say, oh, we love how animals make us feel. We also owe it to them to make sure that everything we do with our pets is also promoting their welfare as well.
And although the concept of the human-animal bond isn't new in and of itself,
we're really, I think, as a scientific community, just starting to understand maybe the tip of the iceberg, if you will, on the power of the human-animal bond. We have studies now emerging from many different fields that support this, but at the end of the day, anyone who shared their life with an animal knows what I'm talking about. You know their day tends to be brighter. We often joke, be the person your dog thinks that you are. And so that's really at the heart of the human-animal bond, that bring out the best in us, and that's what we seek to study at Pet Partners.
How long has the concept of the human-animal bond and our understanding of it been around?
It's a great question. When we look back through history, the human-animal bond has been referred to in so many different ways. Even really early psychologists are known for bringing in dogs into therapy sessions. I've been at conferences where they talk about thousands of years ago and the relationship that animals and people, specifically dogs and people, form together. So I think we've known for a very long time that our lives are enhanced by animals, but we're just now starting to put that scientific vocabulary around our understanding.
Can the interaction between humans and animals produce positive impacts for all ages and stages of a person's life?
One of my favorite things about human-animal bonds and about therapy animal work specifically is that it has been found to impact people all over the lifespan. Everyone from really young to really, really old, kids to people with dementia and care homes. Their day is made better because they interact with an animal.
Looking at child health and development, how does the human-animal bond specifically impact a person in childhood?
There's a lot of different research emerging on children and pets and human-animal bond. We know there are psychological benefits for children, and then also we look at cognitive skills, social skills. There's a lot to support that across many different facets of life that interaction with pets can be really healthy for young kids.
She's witnessed it in her own work.
In my work as a mental health therapist, I worked with incarcerated youth. And so we would model healthy relationship skills, role-taking, understanding how to take the perspective of another living being. So that human-animal bond has been found to be a model for diving into some of those really complex psychological principles.
And Dr. Chastain Griffin adds, kids can be particularly impacted in educational settings.
There's a lot more schools exploring this now. Huge interest in therapy animals in schools, and I get why.
It's because, again, from her own experience,
some of the first research I did, I had a rescued bulldog named Charlie, brought her in for a reading program with kids in the system, several levels behind on their reading skills. And I'll never forget the first day having Charlie sit down next to these kids as they would read out loud to her, and she would quickly fall asleep and start snoring.
Gee, there's a confidence builder. But, surprisingly,
we were measuring their fluency and their confidence and their love for reading, and over 6 weeks, I had to double-check my numbers because they improved so much. They didn't feel judged. There's that non-judgmental sense of confidence building. We also see kids are more likely to engage. The animals bring that grounding, keeping a kid focused on the task at hand. So they're a really great supplement to help in all of those ways.
Has research shown this bond to have an impact on both a child's emotional and cognitive development?
Absolutely. We have findings to support emotional benefits and cognitive development. I think we're probably a little bit farther along in our understanding of the emotional benefits of having pets in early life, but we are starting to get more research in the academic capacity. There's been studies on children's memory task and cognitive skills with the presence of animals being enhanced. So that's a finding that the field will be diving into in the years to come.
Next, we consider the human-animal bond's impacts on healthy aging.
We know that the human-animal bond can really help decrease loneliness and isolation. That was a finding that was really enhanced during the COVID pandemic. People who were all of a sudden having to make their worlds really small, those older adults who had animals fared better because they had an animal.
Again, validating the vitality of the human-animal bond.
Animals help people keep a sense of routine or have a sense of purpose and identity. So we believe that those aspects really help support the mental health and decrease depression and all of those mental health findings we tend to see for people who share their lives with animals in older adulthood.
What about in cases of Alzheimer's or dementia? Can the human-animal bond be beneficial here as well?
I had a rescued poodle named Ivy. Her favorite place to go was the memory care unit. I don't, as a scientist, really have words to explain what I saw in that space. We would have people who couldn't remember family members, but when Ivy came, they could remember her name, they could remember me. Oftentimes, they would revisit memories of animals in their past. I can't explain scientifically what happened there. I just know I would tend to leave with my jaw on the ground at what she was able to accomplish.
And she wasn't the only one who was impressed by this.
It's really like a spark that would light up. You know, something about bringing an animal in would give them common interest and had a way of bringing everyone to the center of the room. And the staff would often say, please come back as often as you can, because it was a really tangible difference.
Dr. Chastain Griffin also highlights how the human-animal bond impacts our physical health as we age.
We have studies that show pet ownership can be protective across a lot of different physical traits. People with pets tend to have lower rates of obesity and tend to be more active. And what's interesting is it's not just dog owners. There's even been some studies on cat owners who have lower rates of obesity, and it probably has something to do with that routine that pets get us into, getting up and being who our pets need us to be.
Plus, the human-animal bond can also have positive influence
on understanding benefits of staying fit and eating healthy when we modeled that through care plans for our pets. Making meal plans for a dog I recently rescued to optimize her recovery, and then it would kind of raise some awareness about, well, if it's important what the dog eats, maybe it's important what I eat too.
Dr. Chastain Griffin also tells us it's important to consider that the human-animal bond can improve specific mental health conditions like stress, regardless of a person's age or their setting.
There's been a lot of research on the impact of human-animal interaction and stress in so many different settings. We have studies bringing therapy animals to college campuses during exam week, where a student comes in reporting that they're really stressed and they leave after 15 minutes with the animal and feel significantly less stressed. Same thing happens, though, even in hospitals. So we know that therapy animals can really help coping with stress.
And research shows measurable impacts in cases of PTSD, trauma, and crisis response. Bottom line, when it comes to the human-animal bond,
it's most beneficial to us when it's beneficial to the animals who we share our lives with. Taking your animal's perspective, adding some enriching things to your animal's life. When you do that, those benefits that our animals give us, those really come to fruition when we make it a priority to take great care of our animals.
And she walks that talk, both professionally and personally.
They call me Dr. Crazy Dog Lady for a reason. I joke oftentimes that I just went to school for as many years as I did so that it was socially acceptable to have as many dogs as I have.
Next, we deepen our understanding of the human-animal bond by learning about the Therapy Dog program at the University of California, Los Angeles Health's People-Animal Connection. Jennifer Dobkin is the program's manager, who tells us what the UCLA People-Animal Connection is.
We are the Therapy Animal Program here at UCLA Health. We have approximately 65 dog teams and 4 miniature horses, and they visit with patient staff and visitors at our 3 hospital locations.
How and when did the People-Animal Connection, or PAC, come to be?
This is Probably not something you're expecting, but oddly enough, PAC started in 1995. It started when a nurse in the hospital noticed a patient positively responding to a fish. So who would have thought that a dog program would have started with a fish? But once she saw how positive the patient's reaction was to the fish, she decided to bring her therapy dog in. So it started with one dog and one nurse's vision, and it has been volunteer-based for the last 30 years, and we've grown the program from there.
And from the onset, their vision has been
primarily to improve the hospital experience as a whole by incorporating therapeutic animal interactions that uplift people's spirits. It's just to bring moments of brightness and joy to every person we meet in the hospital. We hear this a lot during our interactions. This is the best thing that's happened to me while I've been in the hospital, so we think it's working.
To be clear, whereas other programs take therapy dogs out into the community, the PAC focuses on in-hospital visits.
We do some community outreach, but our primary focus is inside the hospital.
But before you go getting concerned about germs,
when our dogs come into the hospital, we take them through different infection control measures. First, within 24 hours, dogs have to be bathed. And then when they get to the hospital, we sanitize everyone's hands that are interacting with the dogs. And then when they're on a patient's bed, we lay a barrier down, usually in the form of a sheet. So we take different infection prevention measures, especially with our patient population.
Next, Jennifer helps us understand differences between therapy dogs and service dogs, beginning with this key distinction.
I think the easiest way to distinguish the two is that service dogs are providing support to one person, and our therapy dogs are providing comfort to many. So kind of an easy distinction.
But there are many others. In looking at therapy dogs,
a therapy dog is beneficial for anybody that really enjoys being around dogs. So I think they're beneficial for anybody that gets to interact with them. They see a wide variety of people, and I very rarely see people that don't want to approach them.
in the context of hospital visits, the primary focus of the People-Animal Connections therapy dogs.
They definitely provide a non-judgmental presence, and they're often a social catalyst, so they encourage people that are sometimes quiet to come out of their shell and talk.
She shares the example of their program called
the Resnick Pups program, dogs that visit our inpatient and outpatient psychiatric unit, and we hear amazing feedback. Some patients are not responsive. They may have previously been aggressive, but they're very gentle with the dogs. So it is really interesting to have dogs interact with people in that kind of setting, and the benefits that we see are overwhelmingly positive.
Is there a breed that are best for becoming a therapy dog?
In my experience, there isn't a specific breed. It's more personality or demeanor based. We have everything from purebreds to mixed breed shelter dogs that got a second chance. And I wouldn't say there's a specific breed that can't be. Our program doesn't exclude any breeds. If the dog is able to pass the therapy animal evaluation, then we will consider having them in the program.
And of course, dogs enter the program as teams, along with their handler, who Jennifer described as
some of the most amazing people I've ever met in my life. The amount of effort that is put into volunteering is astronomical. It takes a lot of work to maintain a therapy dog, and they are just the most generous, giving humans I've ever met.
What about service dogs? Who typically benefits from them?
Service dogs are typically beneficial just for their handler, and the goal is to provide a more independent life for the handler.
Which means service dogs are typically
owned by the handler and they live with their handler. The ownership can vary depending on where the dog came from. Some organizations that provide service dogs may retain ownership in the event that the dog would need to be returned for some reason. So it really depends on where the service dog came from.
Services a service dog commonly provides
mobility and physical assistance, so opening doors, retrieving items, providing balance support. You also see medical alert responses, so allergy detection. There are dogs that can sense that and alert their owners. There's also guide dogs. They assist visually impaired or blind individuals.
But whereas therapy dogs are trained to be pet by virtually anyone, is it okay to pet a person's service dog?
Generally speaking, don't pet a service animal or any animal without asking the owner's permission. That's my opinion. We live in a wonderful time where so many people take their dogs everywhere. However, it has made things really difficult for individuals with service dogs to kind of navigate public spaces safely.
So, before you pet that cute doggy,
Just ask politely, because sometimes they are wearing the vest that says do not pet, but sometimes they aren't. So just ask.
And if the dog's owner says no, it's for a good reason.
Petting a service animal could distract them from the task that they're trying to perform for their handler. For example, if you're at a crosswalk next to a handler with a guide dog, you could be distracting that animal from safely guiding their handler across a busy intersection.
Also, consider
not all disabilities are visibly obvious. If there's an alert dog that is monitoring for low blood glucose or blood pressure, you wouldn't want to distract that dog from providing an alert such as that.
Jennifer says, in looking at notable benefits of therapy dogs on a person's mental health,
studies have shown there can be a decreased sense of loneliness. Sometimes here at the hospital, not all patients have visitors, so we might be the only visitor that they have that day. They've also been shown to help with emotional regulation, and this doesn't only go for therapy dogs. The research has shown this is beneficial for people with pets as well.
And from a physical health perspective, therapy dogs in the hospital
have been shown to increase the patient's physical activity. For example, we'll do what is called double leash walking. The volunteer has one end of the leash, and a patient will have a second leash. So they are able to walk the dog with the volunteer. So it gets them out of bed, it gets them moving, and the dog is a big motivator to help facilitate that.
Now, we discover what it takes for you and your dog to become certified as a trainer therapy dog team. For this, we turn to Lisa Hare, Executive Director of Pets Helping People, a nonprofit organization that provides
training and certification for therapy teams. So basically, people that want to bring their own personal dog out into the community and make a difference.
As for her own involvement,
it'll be 3 years this July. I came from corporate America, and that's a wonderful place to be, but this is soul-fulfilling and fuels your passion. I'm the only employee. Everybody else is volunteer, serving our community, which really speaks to the heart of our organization.
Is Pets Helping People part of a larger national organization?
Many years ago, we were part of a national organization, but we really wanted to remain rooted right here in southeastern Wisconsin, be able to serve our community. So we are a party of one, been around for 28 years, serving our community.
Serving it in a variety of ways.
Certifying those handler pet teams, connecting our teams to community partners, facilities that are looking to have handler pet teams, and really sharing that healing power of pet therapy. It is something that we absolutely love doing.
Now, Lisa isn't saying that there aren't other dog training programs around.
There are, though what I clarify is no one does exactly what we do in terms of partnership with the community. We have over 100 facility partners that I regularly interface with, looking for individual handler pet teams, so a person and their dog, or group activities. So we do about 60 group activities.
What kind of group activities?
Wagon Tails, that's a 1-hour presentation we do for senior centers and memory facilities.
Then there's the one I experienced here at the Medical College of Wisconsin.
Comfort Paws, stress relief visits. There's no presentation. We simply show up primarily at colleges, universities, schools for the students to let go of their stress, especially at exam time.
What makes a good therapy dog? Lisa says it's one that's
friendly, loving, calm, really enjoys being around people. That's most important. We don't want to just do something because the human wants to do it. We want to make sure that the dogs are really enjoying this experience.
How do the handlers know their dog is enjoying it? Oh, they know.
I hear from handler pet teams who will say, when I bring out that special leash or that special harness that they associate with therapy visits, the dog goes crazy. They get so excited because they know they're going to be able to serve in our community. So the dogs really enjoy the experience.
But not every dog is suited to become a therapy dog.
The first step is an assessment for readiness. It's a one-time thing. We will walk around with wheelchairs, walkers, noisy toys, and really what we're trying to do is find out, how is this dog reacting to it? Are they looking like, get me out of here? If so, probably wouldn't be a good therapy dog.
Another important part of the assessment:
we pet the dog. How are they reacting to a stranger petting them, touching their face, holding their ears? Because these are things that will most likely happen out in the community.
Don't think these tests are pass or fail. When dogs go through assessment,
it doesn't mean they have to be picture perfect. It means they have to have the characteristics fitting of a therapy dog. Skills can be trained, but foundationally, you can tell a lot around a dog.
And if a dog isn't quite right for becoming a therapy dog,
that does happen, where someone might think, oh, I think my dog wants to do this, and the dog is running for the door saying, maybe not. So, no, not every dog is a good therapy dog, and that's okay.
Is the age of a dog a qualifying factor?
The industry standard is 1 year old. We want to get that initial puppyhood craziness out. We don't want it to be a frustrating experience when people come through the program with their dog.
And in case you're wondering, I was.
In terms of the maximum, there is no maximum. So as long as the dog is happy doing what they're doing, there is no maximum age.
A dog must also obey certain commands at the time of assessment.
They have to have the basics: sit, down, stay, calm. They have to have all that down before coming through assessment.
Once the initial assessment is successfully completed, 4 weekly classroom training sessions are required.
We have our first class, which is our orientation, foundational information, who we are, what we do, being out in the community. It's important to maintain professionalism at all times, so we talk about that. Appropriate behaviors, supporting our dogs.
In weeks 2 and 3,
we are working on skills, things like leave it.
Leave it? What's that?
They have to walk over a row of tasty treats, not once but twice, and not eat any of them. If we give a command, they have to be able to listen to that. You can imagine how important that is. Somebody drops a pill or a food that is hazardous to dogs. They have to be able to leave it.
Another command skill a therapy dog must master:
down from a distance, down or sit, either one, for 2 minutes at the end of a 20-foot lead. It's 2 minutes that's long for all of us. 2 minutes can feel like 2 hours, but again, these are very important tests.
Culminating in week 4.
That would be their 4th class, the actual exam.
Upon passing the final exam, the dog and their handler are
considered once they've gone through our program. The title would be Pets Helping People Certified Handler Pet Team, and we are recognized by the AKC, or American Kennel Club, as an official therapy dog training organization. So a great perk is that through Pets Helping People, you can also get your CGC, Canine Good Citizen, which is another feather in your cap.
The key is, it is a team.
Our goal is for our teams to be successful in the community and to have meaningful connections.
So, if you want to get connected,
go to our website, petshelpingpeople.org.
If you're wondering whether therapy dog visits could benefit you,
the therapy from a dog is truly priceless. Mental, emotional, physical benefits.
And for any dogs listening,
tell your human to sign up. You got this.
Doggone it, we're all out of time for this edition of CTSI Discovery Radio. As always, thanks to each of our guests for appearing on today's show. Dr. Taylor Chastain Griffin, Jennifer Dobkin, and Lisa Hare. Did you discover something by listening today? I hope so. And I'm doubly hopeful you'll come back next time. CTSI Discovery Radio airs the 3rd Friday of every month. So make an appointment on your calendar and join us for each episode. On behalf of the Clinical and Translational Science Institute of Southeast Wisconsin and all of our affiliate partners and members, I'm Brian Belmer, wishing you happier, healthier days ahead. For more information about research or to listen to the podcast of this or any of our shows on demand, please visit our website at ctsi.mcw.edu. CTSI Discovery Radio is written, produced, and hosted by Brian Belmer in collaboration with WMSE Radio. The CTSI and this program are under the direction of Dr. Julie Freed.